All right, everybody on page 11?
Yeah. And you on page 11?
I'll explain in a second. Right? So today, in dealing with anatomy, a lot of times, whether you're in the profession or not, you will hear certain terms, and like any other job or profession you're in or dealing with some subject matter, you have to know the relative vocab that goes along with it, and I guess the terminology, you could say. And so what we're looking at today on page 11 is the language of anatomy. So if you follow along with me, it says, learning about the body is exciting, but our interest sometimes dwindles when we're confronted with the terminology of anatomy and physiology. So as we go out throughout this year, the terminology and the language of anatomy is going to be very important to help you understand what region of the body we're talking about, what specific system and things like that. There's clues in these words that can help you figure out what we're looking for. So it says, let's face it, you just can't pick up an anatomy and physiology book and read it as though it were a novel. Unfortunately, confusion is inevitable without specialized terminology. For example, if you're looking at a ball, above always means the area over the top of the ball. Other directional terms can be used consistently because the ball is sphere. All sides and surfaces are equal. The human body, of course, has many protrusions, bends, thus the question becomes, above what? To prevent misunderstanding, autonomists have accepted a set of terms that allows body structures to be located and identified clearly with just a few words. This language of anatomy is presented and explained next. Okay? So the first thing we're going to go over is in anatomy, you have what's known as the anatomical position. So I want everybody to stand up right here. Everybody stand up. Okay? Toes forward. Go with the bar. Straight forward. Okay? And I want your hands turned out so your palms are facing forward. Okay? This is known as the anatomical position. Okay? So anytime we're referring to a body, let's say on a question, on a test or anything, this is the body position that I'll be referring to. Okay? Now have a seat. So hands facing forward, and just like this. Alright? So, it says, the anatomical position. To avoid confusion, it is always assumed that the body is in a standard position called the anatomical position. It is important to understand this position because most body terminology in the book refers to this body position, regardless of the position of the body happens to be in. Okay? So turn to the next page. Now, these terms in table 1.1, these are going to be very valuable to you. Okay? And if you notice, okay, as we go through them, you're going to notice they're in opposites. Okay? So superior and inferior. Okay? So it says the definition of superior, towards the head or the upper part of the body. Inferior is away from the head, okay, towards the lower part of the body. So they're opposites, superior and inferior. Okay, same thing with anterior or ventral and posterior or dorsal. Anterior would be towards the front of your body, okay, the ventral side. So that would be like where your belly is, your abdomen and stuff. And the posterior side would be the back, the dorsal side. Okay? So if you get confused with those two, think about it this way. The dorsal fin on a fish is where? On the back. That's how you remember that. That's the reason it's named that way. Okay? Medial and lateral. Medial is towards the midline of the body. So imagine you have a line down the middle of your body. Medial is towards the middle. Lateral would be to the sides. Okay? Then you have intermediate. And then you have proximal and distal. Okay, this one gets a little confusing. Proximal, meaning it's closer to the body. Distal would be further away. So if I was in anatomical position, okay, my elbow is distal to my shoulder because it's further away from the middle of my body than my shoulder is. Okay? So if I was right here, My ear is distal to my nose. Okay, my eyes are proximal, closer to the middle, to my ears. My eyes would be proximal to ears. Okay? And then our last two, superficial and deep. Superficial is dealing with going actually into the body. Okay? So your skin would be superficial to all your organs. But your, let's say, your heart would be deep to your sternum, your breastbone up here, because it's further into your body. Okay, so superficial and deep. So these terminology right here is going to be very important throughout the entire year. So if you wanted to make a chart on this in your notebook to use, you could do that, but I'm not going to make you write these down. It's just a table there. Proximal and distal again. So if I held my hand out like this, but proximal means closer to the middle of the body, distal's further away. So if I was comparing my wrist to my elbow, you could say my wrist is distal to my elbow because it's further away. Okay? Make sense? Your elbow would be proximal to the wrist. It's closer to the middle of the body. Good? Okay. So these directional terms, it says directional terms used by medical personnel and autonomists allow them to explain exactly where body structure is in relation to another. So here we have some examples. We've done some together. But let's do this one. The wrist is blank to the hand. Proximal, because it's closer to the middle of the body. Okay? Here's one. The breastbone is blank to the spine. Anterior. Very good, because it's towards the front of the body. Your spine would be on the ventral side. Okay? Your brain is blank to the spinal cord. Think about it. You have your brain up here, and then your spinal cord. Somebody said it. Superior. Your brain is superior. It's higher than your spinal cord, so it's above your spinal cord.
Yeah.
Difference?
Yeah, I feel you.
Okay. Here's another one. The lungs are blank to the stomach. So think about this one. Your stomach's here in the middle. Your lungs are on either side, correct? So which one would we use? The lungs are blank to the stomach. The stomach would be medial, but the lungs, since they're the sides, would be what? Not deep. Deep, think lateral. Here we go. Let's look at it. Here we go. So we've got our stomach. Here's the middle of our body. Okay? Here's our stomach. And then here are our two lungs. Okay? So this would be medial, but our lungs would be lateral to our stomach. Okay?
This is crazy.
When you talk about deep, think about digging something. Like when you dig down in the dirt, okay? Think about digging deeper into the body.
Oh, we have to memorize these.
Yes, you will have to know them. You will have to know them.
Can you
Okay?
give us another example after this about deep?
Yeah, I'll give you another example. Okay, let's do this one, this last one. The thumb is blank to the fingers. So remember our anatomical position.
Oh, lateral.
We would say lateral. Okay, because it's towards the outside. Okay. Now, you could also say one more. What other one could you say? Not distal, proximal, because they're closer. Where it attaches, it's closer to the middle of the body. Okay. Another one for deep. Let me think. Your thinking on the head. Your deep's a hard one. It is a hard one. Here we go. I'm going to go with a bone, okay? In your arm, you have two bones. You have your radius and ulna, okay? The way you remember that, the radius is on top, it's on the thumb side, your ulna's on the underneath side, like pinky, P-U, pinky, ulna, your ulna's underneath, okay? But your radius is deep to your skin. Makes sense now? Want some more? We're pretty good. It just takes a little bit of practice. We'll have practice questions on it and to get you thinking on it, okay? Now your regional terms, okay? You have body landmarks that we're going to be talking about. And you can see them all there in bold, okay? On the anterior side of the body and the posterior side, okay? And if you learn these now, when we get to the muscular system and the skeletal system, you'll see these words repeat, okay? Because a lot of your muscles, where they're located, are named for their region, where they're located at on the body. Okay? I know it's kind of overwhelming right now looking at all of these, but it's actually a lot easier than you think, okay? Go ahead and turn to the next page so we can get to cutting, all right? So your body is also divided into planes and sections, and that's what we're going to look at right here, okay? It says, when preparing to look at internal structures of the body, medical students find it necessary to make a section or a cut. When the section is made through the body wall or through an organ, it is made along an imaginary line called a plane. Since the body is three-dimensional, we can refer to the three types of planes or sections that lie at right angles from one another, okay? So our sagittal plane is a cut made along lengthwise or longitudinal plane of the body, dividing the body into right and left parts. So look at figure A on the next side, where it says the sagittal, it says mid-sagittal, okay? So if it says mid-sagittal, think of median, middle, it's dividing the body directly in half. But what you can also have is a contra-sagittal, and that's where it divides, let's say, down this right side, not down the middle. Mid-sagittal, contra-sagittal. Okay, so it would just be like dividing it right here. Okay? But a sagittal plane is dividing it into right and left halves. Okay? A frontal section, you can see there in figure B, anatomical position, is dividing the body into a front, that frontal section, and a back section. So you have an anterior side and a posterior side. The frontal section or the frontal plane is also known as the coronal plane. And then lastly, the transverse is made on a horizontal. So it would be cutting the body into half, upper and lower. Okay? You could also do this on the head if you cut off the top of the head to look at the frame or something like that. Okay? So what we're going to do right now, let's get into, we can get into groups of 2 and have one group of 3. Alright? So go ahead, spread out at different tables. I'm going to have y'all cutting. Alright? So what each group is going to do, yes, these are right. Don't eat them. Alright? I'm going to mark on our apples, okay, the anterior side and the posterior side. Okay, so anterior is which way? Front, posterior, back. Alright? And what we're going to do is you're going to make the cuts on the planes. Okay, I'm going to give each group a different plane to cut on. And then, we only have one knife, we'll have to pass it around. Please be careful, it is very sharp. Alright, so be thinking about the planes, right? I want y'all to make a